Hi, I'm Dr. Tom Tulios. I've been here at Greenwood Chiropractic for over 30 years. Recently we have just added the regenerative medicine component to our office. So the reason why I've introduced regenerative medicine to this office is because basically, first of all, I'm getting to that age where most of my joints have started to wear out. I've played sports. I've had multiple knee injuries. And as of recently, I've had both my hips replaced. And unfortunately now, through my orthopedic surgeon, I was recommended to have my knee actually replaced as well. And I certainly am not ready for that. I'm too young, and my concerns were always that if I have these hip replacements or knee replacements too early, that I would need a second one. And we know that second knee replacements are really difficult. They're a lot more, they're much more difficult to do. So what I was looking for is other alternatives and try to prevent, delay the surgical procedure. So that's how I really started delving into this. The other reason is that stem cell and hyaluronic acid now are widely used. They're used at Stanford, Johns Hopkins, even Mayo Clinic are using stem cells to heal and repair joints. And after doing further research, that is why I started to look into introducing this to our own practice. A lot of this is based on what I see with my chiropractic patients. Many of my patients, even by the age of 17, are already exhibiting signs on X-ray of degenerative changes to their spine. Their discs are getting thin, they're getting bony spurs. And much of the focus is, when patients first come in, is obviously to decrease or eliminate the acute pain, the pain that they're having currently. But I've changed that focus to how do we prevent or slow the progression of that arthritic change. And so I've been doing that with my chiropractic patients for many, many years. And now I would like to introduce those proactive concepts on knee osteoarthritis, joint osteoarthritis in general. Hi, I'm Dr. Tom Tulios, director here at Greenwood Regenerative Medicine. I want to thank you for being here today, and I want to share with you some of the basics of regenerative medicine as well as lifestyle medicine. So I'd like to start by discussing some of the causes of osteoarthritis. Many of those causes many of these problems arise from old injuries, sprains, strains, falls, any sort of trauma that may occur early in life. Second one, and very commonly found, is the repetitive type injury stresses, which are from running, jumping, walking on hard surfaces. Those are very, very common. They accumulate gradually over time in life. The third one is genetic factors. Genetics play a significant role, from the alignment of your body to how your body repairs and heals itself when injured. And what's interesting is that half of the world's population over the age of 65 has some sort of arthritic changes that is causing pain to them. So it's very, very common in our society. And in fact, by 2050, it is estimated there will be a 147% increase in knee and joint replacement surgeries in this country. So it's very common, and early intervention is critical. Now, there are 4 stages of osteoarthritis. Let's review the stages of degenerative changes. They're graded 1 through 4. So at grade 1, there's very little joint space loss. Maybe some small osteophytes forming on the side of the bone, which are little bony spurs. That's the first stage, stage 1. Stage 2 is when we start to see thinning of the joint space. You can see here, compared to the outside of this knee to the inside, how this space is reduced significantly. But there's no pain. There's still joint space remaining there, and there's still cartilage in that space. Now, when we go to stage 3, what we start to see is a significant loss of that joint space. As you can see here on this X-ray, if we compare the outside of this same knee to the inside, you can see the spacing on the outside is quite thick, but the inside is reduced. Now, in grades 2, a person may feel just occasional pain. maybe pain when they're going up and down stairs or walking, but it's not there all the time. When we get to stage 3, now we're seeing pain that is very frequent or always occurring when you're going up and down stairs, walking, jogging, or doing household activities. And of course, there's grade 4. Grade 4 is when the joint is completely damaged. At this stage, the pain can be severe. It's almost all the time. And at this stage, really the only direction or option that somebody may have is a knee replacement or a joint replacement. So here's a great x-ray of grades 1 through 3 in osteoarthritis of the knee. So this left knee on the outside surface here, you see this dark band in here. This is where the cartilage is. This is what wears out in osteoarthritis. This is grade 1. There's mild thinning in that space, and there's some small bone spurs on the outside. As we move to the medial portion of this left knee, you can see how the space is reduced. It's not as thick as this side here. This would be considered grade 2. Now, when we go to the right knee, you can see the outer portion of this knee looks pretty healthy. The space here where the cartilage resides is pretty thick. But when we move to the medial portion of this knee, we can see the space is significantly reduced, particularly as compared to the outside portion. So this would be considered grade 3 of joint degeneration. And what's interesting is that at grade 2, there may be little to no pain, but the cartilage is wearing. As we move to grade 3, this is when you start to experience frequent pain with activity. So that's the differences from grade 2 to grade 3. And obviously, this is where we want to start treating the joint, when it's in grade 2 and 3. So what are the goals of treating osteoarthritis? First of all, it's critical to catch it early, being proactive rather than reactive. So we ideally want to catch it in stage 1, stage 2, or stage 3. But the sooner you start the management of these conditions, the better the results will be. Obviously, when you get to stage 4, there's only one option, and that's typically joint replacement. You can manage the acute pain short-term with cortisone or some other medications prescribed or over the counter. But at that point, the joint is gone and needs to be replaced. Obviously, another one of the goals is to control the pain and improve the quality of life. And we also want to limit the use of medications on a consistent basis. So the goals are to start treatment early before the progression of the disease occurs. So some of the common treatments and recommendations are exercise. That's the easiest to start with. Low to moderate impact exercises like walking, cycling, household chores, mowing the lawn. Day-to-day activities are also considered exercise. So that's a very important part of treatment or managing these conditions. Another one is an anti-inflammatory diet, such as the Mediterranean diet. Inflammation plays a primary role in the amount of damage that can be done to the joint. So having an anti-inflammatory diet can decrease the likelihood or decrease the rate of degeneration of a joint. Weight loss. Weight loss is critical. And there's one study that shows that for every pound of weight loss you have, or reduction in weight you have, you decrease 4 pounds of shock or absorption to the joint. And if you could imagine for a 1 mile walk, you're reducing the stresses by reducing just 1 pound of body weight up to 4,800 pounds of force on that joint. So you take off 10 pounds, you're looking at 40,000 plus pounds of force reduced on that joint. So that obviously can save on the wear and tear of that particular joint. Staying well hydrated helps preserve the joint. Supplementation with glucosamine, chondroitin, and collagen could also help preserve that joint space. Studies have shown that 8 to 12 weeks of supplementation with curcumin could reduce osteoarthritis symptoms similar to that of taking nonsteroidal anti-inflammatories like Motrin, Aleve, or even prescription anti-inflammatories. So now let's get into a little bit of viscosupplementation. Obviously, most of you know this as gel injections. These gel injections consist of hyaluronic acid, which naturally occurs within the cartilage and the joint synovial fluid. So everybody has hyaluronic acid within their joints. This hyaluronic acid acts like a buffer. It's like a lubricant between the joints. It reduces friction and also helps absorb shock forces. So hyaluronic acid is very effective for treating osteoarthritis of the knee without increased risk of adverse side effects. Hyaluronic acid provides a more immediate relief of pain and lasts up to 6 months, which is why insurance covers and allows this procedure every 6 months. Now I would like to get into stem cells and regenerative medicine. There's 3 potential sources for stem cells. One is adipose tissue, where it's collected from somebody's own body fat. The other one is bone marrow. Bone marrow can be drawn from the pelvic area through aspiration and could be used as stem cells to treat a joint in the body. And third is umbilical cord tissue. At our office, we use umbilical cord tissue due to the fact that it has mass quantities of mesenchymal stem cells. The umbilical cord has mass quantities of mesenchymal stem cells. Mesenchymal stem cells are responsible for healing ligaments, cartilage, tendons, and bone. Umbilical cord tissue contains a tremendous amount of cells and proteins that work to help repair and regenerate damaged tissue in the body. So how are these mesenchymal cells or mesenchymal cells obtained? So first of all, they're collected from a consenting mother who is 35 years of age or younger. They're taken from scheduled C-section births. So this is a healthy mother, and the mother is screened heavily for any pathologies or any significant diseases. So these tissues are collected, they're put in sterile containers, they're brought to a laboratory, and through FDA-approved methods are processed for use in the human body. At the laboratory, they're also taken through a process where all DNA factors are removed. So there's no chance of rejection, and there's no immune reaction from the injection. So all DNA factors are removed, so there's no possible rejection or immune response from these cells. So these cells are then cryogenically preserved at a minus 150 degrees Celsius, so they preserve all the qualities that are required. So these umbilical cord tissues have tremendous amount of cells in them and proteins, which help the body repair and regenerate itself. So how do these umbilical cord mesenchymal or mesenchymal stem cells work? So we're not talking about completely curing osteoarthritis. That's not possible. What we're talking is about helping the body regenerate. So what is happening is what I'd like to call mitigation. So you're always making new cartilage, but with degenerative changes, the cartilage that you're making is less than the cartilage that you're losing. So you begin to lose that joint space. So you're always making new cartilage. But with degenerative osteoarthritis, you are losing more cartilage than you're actually making. With stem cell treatments, we are changing the ratio of cartilage loss, where we are making more than we are losing. So with stem cell treatment, you'll see regeneration occurring from 3 months up to 1 year. And the results can last 1 year or even up to 4 to 5 years, depending on how much stress and pressures you're putting on the body and what phase or grade of degeneration that you're in when we start. It depends on how much wear and tear you're having on that joint. How much activity. Are you playing tennis? Are you running? Are you jogging? Or it depends obviously on your body weight. That plays a critical role as well. So we have all these factors that determine the length of time that these treatments will be effective for. So let's talk a little bit more of what's in these injections, these stem cell injections that you're getting. First of all, there's cytokines. Cytokines are very good at reducing inflammation and modulating autoimmune conditions, such as rheumatoid arthritis, lupus, and many, many inflammatory illnesses. So when you have an injury, your body releases cytokines, particularly interleukin-6. So what these cytokines do are actually signaling your own body to send healing cells to that area. They're bringing people in to do the work and letting the body heal. So they're drawing in different types of cells, including your own stem cells, to that region to begin the repair and regeneration of that damaged tissue. So cytokines are always present in any injury. When you cut yourself, whether you break a bone, cytokines play a primary role in basically signaling the body that there's an injury and causing the body to send cells to that area to begin to mend or heal that tissue. Cytokines work by signaling cells to communicate to your body that there's an injury and that there needs to be a repair or restoration of the tissue. Cytokines signal adult stem cells to go to the area and make new cells, which help in the regeneration and degeneration of the tissue. There are also growth factors. There are also over 80 growth factors in this biologic that we're putting into the body. So growth factors are very good at being like construction foremen. A construction foreman doesn't do a lot of work, but they call on others to build, and they kind of organize and manage the job that needs to be done. So these growth factors call in other cells from your own body to help repair and regenerate injured tissue. There is a lot of signaling that goes on between the biologic that is injected. So not only does it do a lot of work on its own, it also calls in reinforcements to help the repair and regeneration of the tissue. Also present are mesenchymal stem cells. These mesenchymal stem cells are collected from part of the umbilical cord called the Wharton's jelly. That's the protective lining that covers the arteries and blood vessels of the umbilical cord. So if there's any damage, the body immediately repairs it. So there are huge amounts of mesenchymal or mesenchymal stem cells present. These stem cells are what repair your joint tissues. They make ligaments, cartilage, bone, and tendon. So we need these mesenchymal stem cells to help with that repair process. And there's huge amounts present in these biologics that we're putting into the body. So the goal of these biological treatments that we've mentioned are to slow down the progression of osteoarthritis and even help regenerate that particular cartilage, ligament, or tendon that has been damaged. So I'd like to share with you a few stories from our patients that have received stem cell therapy.
Nancy Crane.
All right, Miss Nancy Crane. And where were you having issues with?
In my left thumb and across the palm of my hand.
And how? What experiences were you having? Pain, stiffness,
pain, stiffness. I could not use my left hand at all. I couldn't pick nothing up. I would literally drop things if I tried to pick it up.
Oh wow!
So.
And how are you feeling today?
Oh, probably 95 to 99% better. Every once in a while, I feel a little ping or something like that, but then it goes away.
Are you able to pick stuff up?
Oh, I can do anything I want with that hand.
Well, that's really lovely to hear. So. All right, well, thank you so much.
Right, thank you.
Hi, I'm Steven. I am 68 years old. I came in because I was bone on bone particularly on my left knee from playing basketball my whole life. And my doctor at another facility wanted to replace both my knees. And I got a stem cell shot in my left knee about a month ago. And I'm amazed at how much pain is gone. I don't have the bone-on-bone pain any longer, and I'm going up and down stairs, and I'm not feeling the pain inside of my knee, and I'm just like ecstatic about it. So thank you, doctor.
My name is Darcy, and I am 50 years old, and I received some injections in my right hip. Prior to the injections, I had a very difficult time walking. It hurt. I could barely walk without being in tears. I was hobbling all the time. It was just very, very painful. Even simple little things as bending over, tying my shoe, putting my shoe on, my sock on, even getting into my car was extremely painful. And after I received the injections, I noticed within the first about 2 to 3 weeks, I could walk with zero pain, which was the most exciting thing ever. And even the simple things are still a little bit tight, but not painful. And I noticed that every day they're getting better. So I was just very excited.
My name is Cindy.
All right. And what kind of problems or pain were you experiencing?
I had lower back and hip pain in the right hip, and had it for 10 plus years. So it was basically pain every day.
And how was that affecting you? Mobility, sleep?
All of the above. I lived with it. I have a high tolerance of pain, so I lived with that. But it was getting to the point where this is crazy. Let's try to figure out why is it doing it, and go from there. And that's what brought me in here.
Okay, if I'm not mistaken, you had your stem cell procedure done approximately 8 weeks ago?
Yeah, about that. It was first week in November.
Okay.
In the right hip, and immediately 2 to 3 weeks, I felt less and less pain.
Okay.
I'm to the point now where I wake up pain free 99% of the time. Every once in a while I'll have a little twinge or something with a little bit of pain, but mainly it's gone 85-90%.
Oh, that's really great to hear. Would you recommend it for a friend?
I would recommend it to anybody. I've already given it your name to 4 different people to come in and get a consultation. So yes, definitely I would recommend it to anybody who has any type of pain, whether it's hip, back, any type of joint pain. I would say it's phenomenal.
All right. Thank you very much.
Thank you.
Eileen Cassidy.
All right, Eileen Cassidy. And when you first came here what was your biggest issue, your biggest concern?
My knee. Okay, my right knee. I'm really like bone on bone. All right, and I had gone to I had an MRI done, and my primary care doctor sent me to a knee specialist. All right, and the knee specialist, they took some more pictures and stuff, and they gave me a cortisone injection, but then they gave me 4 knee injections.
Okay.
But I was surprised that they didn't last.
Okay, the cortisone didn't help?
Yeah, temporary relief. Okay. But when I went in for the knee injections every week, I was surprised it didn't help. And it just made a lot of sense to me what he talked about, that this is a stem cell thing. This is not steroid injections and stuff like that. So I came here to have a visit with him, and I really thought it would be something for me, and it was.
And how are you doing today?
I'm doing wonderful.
How's your right knee doing?
It's doing great. I am very cautious because I'm very cautious because what I do is I do no longer knee on this knee without knee pads.
Okay.
All right. Only because I had a husband that had knee surgery. And well, it's just, they were at the house anyway, and I probably would have bought them if not nothing else. But to not put any pressure on that knee.
Okay. And are you happy you had the stem cell treatment done on your right knee?
Oh, yes, I am. Yes, I am. And I would recommend it to anybody.
All right. Well, thank you very much.
Uh-huh.
So in summary, there are many options to manage osteoarthritis, combining diet, exercise, supplements, stem cells, and hyaluronic acid to achieve optimal results and improve the quality of life. So thank you for watching. I look forward to meeting with you shortly and reviewing your treatment options.